Welcome to those of you that are joining for today's webinar. We'll just give attendees a minute or so and then we shall kick off today's session. Welcome everyone, thank you for joining today. We'll just begin to kick off today's session. I know that people are still joining, but I wanted to thank you for joining for our second Pledge With Us webinar. And today we're going to be focusing on eliminating mental health stigma in the workplace. We're delighted to be joined by two fantastic speakers today. We've got Nancy Lengthorn, the Global Chief Inclusion and Culture Officer at MediaCom, who is a WPP agency, one of our founding partners. And then also Tiernan Brady, who is the Global Director of Diversity and Inclusion at Clifford, who also sits on our steering group at the Global Business Collaboration. Before I hand over to our speakers though, I am just going to give a little bit of background to today's session and also to the Global Business Collaboration itself, for those of you that perhaps haven't heard too much about us yet. So the webinar today is an hour. We will hand over to speakers to present for 10 to 15 minutes each. And then we have some good amount of time at the end for Q&A. So please do use the Q&A function on the webinar throughout the presentations. And what we'll do is we'll collaborate and sort of bring those questions together and put them to our speakers at the end. There's also a chat function, so please do feel free to interact with one another on that too. And then in terms of the Global Business Collaboration, just a little bit of background about who we are and what we do. We launched at the end of January, so still relatively new. It's a business-led group with a mission to advocate for business leaders to prioritise this important issue, but also to accelerate that progress by sharing insights and good practice. And we are doing that in three ways. The first is a really important focus on collaboration. We know that no one business has the answers to all of these challenges. And it's important that we connect business leaders and bring people together alongside experts from across the world as well that have been working this space for a very long time. And then secondly, we have a key objective to continue to raise awareness of the importance of workplace mental health. The pandemic's been brilliant in sort of bringing this back into focus, and a lot of business leaders are paying more attention to this important issue, but there's still a lot of work to be done around convincing business leaders, not that this is just the right thing to do for their workforce, but also that this brings business benefit to their organisations too. And then thirdly is the facilitation of the adoption of good practice, which today's session is all about. And our ambition here really is to provide that sort of insight and opportunity for businesses to speak to one another about what's been working well, and also start to signpost some of those free resources and tools that are available that can help you in building your own strategies for workplace mental health. And that is all framed around our leadership pledge, which we launched at the end of January, and we have over 70 organisations now signed up. The pledge is built on lots of the charters and frameworks and standards across the world, but it's elevated to a level that means that no matter where your organisation is in the world or what part of the journey you're on, you can pick this up and use this as a framework to deliver workplace mental health strategy. The Pledge With Us series is built around these different areas. So we had our first session on building an action plan last month with Unilever and BHP. That recorded session is on our website if you missed it and would like to revisit. But today's session, as you know, is all around how we eliminate stigma in the workplace, and we'll be in the coming months covering off the other pledge areas that you can see on the screen. But without further ado, I'm going to hand over to our speakers now, who you're here to see today. And please, as a reminder, do use the Q&A function on the webinar to enter your questions. You can do that throughout the presentations, and we shall collate these at the end and make sure that we get our speakers to answer those. So thank you very much. And Tiernan, I'm going to hand over to you now to talk about Clifford Chance and your journey.
Thanks very much, Rebecca. I think probably what I wanted to do today actually was specifically to talk around the importance of campaigning around stigma, and how do you build campaigns to tackle this, and why we need to think of this through a campaigning lens. I suppose, firstly, that's part of how I ended up in Clifford Chance. I've been the role for about 2 years here, but had come from the world of campaigning, which was, many of those campaigns were, very directly connected to stigma. I was the director of the Australian campaign for marriage equality, the public vote, in 2018. On the yes side, I should probably say, as I would be a remarkably strange hire if I had been the leader of the no side. Which we won, thankfully, and had been the political director of the Irish campaign for marriage equality up to 2015, which again was successful and became the first country in the world to pass marriage equality by a public vote. Before that, I had been the policy officer for GLEM, which was the national LGBT organisation in Ireland, and we'd done a lot of work as well around HIV, and all of these campaigns, in a way, especially the HIV one, really focused on the challenge of stigma and how tricky it is to dismantle. And I thought maybe that's what would be useful today to think about for the perspective of everyone watching today, is to think through, well, what are the principles that underpin a good anti-stigma campaign, for the want of a better phrase for it. And how challenging it can be. So, and I think the first place to start actually on this is, that this is a permanent campaign. And I think we need to think of it that way. When we're trying to take on stigma, we're taking on something that's very enduring. And you're trying to run a campaign to unravel hundreds, if not thousands of years of attitude. And that's a challenge. And that's the scale of the challenge too. And that's in a way, we need to remind ourselves of that. So this isn't, as simple as pushing a door or announcing a policy or rolling out, a single initiative or having a nice one-day event. What we're trying to do is tackle embedded cultural attitudes that were built long before any of us or any of our great-great-great-great-grandparents were around. So that's not going to be done in a simple day and a simple moment. I think, the other bit about that is, as well as trying to take a look at our own workplaces to unravel this stigma and the level of challenge in that is, so you're trying to unravel thousands of years or hundreds of years of embedded thinking, but also that embedded thinking still exists, and it exists both in our workplaces and outside our buildings. So even if we get the campaign correct in our workplaces, we have to remember that everybody returns to the real world afterwards, and they're going back to a world where all this social stigma is all too often totally embedded. So I think, for the purpose of today, one of the first principles of successful campaigning, if you're trying to do this in a workplace, is the permanence of this. understanding the scale of trying to unravel an attitude that has existed for centuries, but that continues to exist outside your doors. And that means there has to be a commitment to permanent campaigning. The idea that you are constantly working on this, that your communication on this has to be both continuous and constant and clear. Because otherwise, as soon as you stop pushing this, the real world, takes back over in terms of creating the tone and the narrative around this. I mean, and I think that, getting your management within firms and the leadership within firms to understand that that's the level of continuous campaigning that's required, or else this becomes an incredible amount of expended energy that doesn't change anything. Because it becomes, Sisyphusian almost. You end up having the world's greatest initiative that lasts a month, and then everybody goes back to work, and the tide takes it out, and all the good benefit of it disappears. So being ready and prepared to commit to this being a permanent campaign, and one that you're planning and designing on that basis, that this is constant waves of communication, because otherwise the progress won't sustain itself. And I think, in a way, for Stigma, this is even more challenging than campaigns to create rule changes or law changes, because, when we think sometimes about progress, we can sometimes be quite lax about it, and we can think that it's inevitable, when in fact there's no evidence to suggest that it's inevitable. In fact, there's all the evidence in the world to suggest progress is the least inevitable thing in the world. It only happens when there's a commitment and constant leaning in, constant pushing, constant campaigning. But of course, the other thing about great social change is it can be the victim of itself, in that it becomes so successful that very quickly people think it was always easy to achieve it. So you run a brilliant campaign, and then everything feels awesome for a couple of months, and you think, this is just so awesome, it's going to sustain itself, and it won't. So first principle, I would say, is the idea of constant and continuous campaigning, and knowing that from the very start you have to devise a plan that shows that. I think the other piece that became very important for us when it came to campaigns around marginalized communities and marginalized people and people facing significant stigma was the ability to create space for conversation. And we knew that this was a real problem in trying to drive real change, because we knew that there was a lot of people would like to care and did care and wanted to ask people questions around how they were feeling. Or in the case of other minority campaigns, for example, when we were doing marriage campaigns, stigmatized communities, asking them what they felt about the issue. But the fear of getting language wrong and the fear of not being able to engage in a way that would be seen as respectful just stopped people engaging. And that was a nightmare for us in campaigning, because what we need people to do is create great conversation and create that space. And we have to allow people to know that it's good to talk. So creating an environment within your permanent and constant campaign that is always messaging and thinking about, how do you create tone that creates space? How do you create tone that allows people to confidently know that their discussions are valuable? And in fact, its discussions on the ground are probably one of the greatest drivers of real cultural change. And if people are scared to have those discussions, then all of that can't happen. And in a way, I mean, I think about how much people wanted to ask in the run-up to campaigns around HIV and stigma and LGBT dimensions on stigma as well. People just go, well, I'd love to ask Auntie Mary a question about this, but I don't know the acronyms. I don't know the right terminology. If I get it wrong, will Auntie Mary throw me out of the house or you think I'm being disrespectful? And in a way, the world of inclusion creates these barriers ourselves, because we're learning all the time, which is brilliant. But part of that learning is we're also creating new lexicons and new libraries of words and all these new concepts, which are incredibly important. But we have to make sure they're not barriers to people having conversation. We have to allow people to know that you don't have to be an expert to be an advocate. And what we really want to challenge stigma is individual advocacy. So taking away the barriers, allowing people to know that, you're going to get language wrong sometimes, you're going to stumble on the words, and I think that matters greatly. It also turns out, of course, when people start to talk, because they really enjoy it, because it turns out we do like each other's company. And it turns out many of us really want to ask these questions, and because we want to support. So it becomes this great unlocking if you build a campaign that understands that barrier to conversation is real and that it won't take itself down. You have to work out how that stigma campaign takes it down. And in a way, this is about having faith in people. And I think, underneath it all, I think this is so important for us, because I think people have phenomenal capacity to be awesome advocates. And in fact, when it comes to changing culture, each of us are the most powerful ambassadors in our own space of our own values. Our job, if we're trying to campaign to unlock and challenge stigma, or to challenge stigma rather, is to unlock that space and unlock that our individuals' confidence, so that they can see that they are great agents of change when they make space for communication. So making space for communication is so critical in this. And again, I don't want to say make this challenging. That's hard in the current world. In the current world, the tone of conversation, if we turn on our mobile phones in the morning, isn't that pleasant communication conversation space. And this is a really important piece for challenging stigma at the moment, as in general, because even when we look at the media, not just social media, what constitutes public debate all too often is just public argument, and lots of sound and fury and no light for people. So actually empowering individuals to create that space is even more important, because the venues where that used to be created aren't as useful at it anymore. And we have a whole range of new technological venues, like in social media platforms, which all too often are creating the wrong environment and the wrong tone. So making space for conversation, second one, that's it. I think the third and fourth point. The third one on this one is inclusion and tackling stigma is about understanding that the issue is a who and not a what. And how do you make space for people to take the journey from what to who? Stigma all too often is not even all too often, is easier when it's against a thought, when it's against a concept or an idea. So in the same way that marginalization is easier when a topic is when a group of people are dehumanized, when it becomes a topic or a theory rather than real people. So making sure your campaign allows people to take the journey to who is so important. And part of that, again, is, it turns out, and maybe I'm an optimist about the world, it turns out I think people are pretty awesome when you create the right environment for them. And I think when it comes to stigmatizing people tend to not want to do it. It's not in our human nature to want to. It is much easier to do it when it just becomes a theory. So using your campaign to present the power of human stories, and you putting those human stories, that visibility of humanity in the center of your campaign, isn't just a nice thing to do. It's actually utterly central, because it is only when people start to take that journey and understand that inclusion is a who that they can become transformed in their opinion on stigma, and become real advocates in wanting to actively dismantle that stigma. So whether that's campaigns like we have done here, around constantly profiling human experiences, sometimes people talking directly about their own mental health and well-being, but sometimes it's people talking about the challenges of mental health and well-being for somebody else. All the time thinking, when you're running a great communications plan that's trying to bring out the humanity of an issue, that there will be many different voices and faces that will connect for different people. And sometimes that will be someone talking about how their parent dealt with well-being. Sometimes it's about how their spouse dealt with it, or sometimes it's their own journey. But knowing that a great campaign is a collection of all of those. So I think that third point is, for us, is inclusion is a who, not a what. And therefore human stories are transformational in challenging stigma. And my final point, and then I'm gonna hand over to Nancy. My final point quickly on this one is, you have to actively demonstrate your commitment to challenging inclusion. I think this is a big challenge sometimes in a lot of workplaces. In a lot of workplaces, because they don't all have cultures where we do put up our hand and ask a question in case we get the question wrong. It becomes all the more important that our campaigns empower people to go, actually, you can have the best values in the world. You can hate stigma. You can think stigma against people who have people experiencing different level of experience around well-being. You can hate the idea that there's a real stigma out there, but if you're not telling anyone, or if you're not challenging it, then it's a secret. And the real danger of values is when they're kept in our head and not actively demonstrated, because for two things. One, the obvious one, you're not driving change, but the other part of that is the impact that has on people who are stigmatized. So if you are someone who experiences stigma or fears stigma from mental health and well-being, and you live in the real world, and you come to work every day to your workplace, then your experience of the real world has taught you that there is stigma against mental health and well-being. That's just the reality. So that's the experience you will expect everywhere until someone actively demonstrates otherwise. So for people in our firms, our campaigns have to allow them to understand and appreciate that silently having your values in your head isn't just not part of the solution of challenging stigma, it's part of the problem of not being able to challenge stigma. Because people who've already experienced it will just presume that you aren't necessarily the person who is going to challenge stigma. Why would they make the presumption that you are? So understanding that your campaign has to draw out active inclusion in people, I think, is so important. How do you empower people to see that when they're actively demonstrating their commitment, not alone are they changing culture, but they're sending radically powerful messages to individuals who have faced stigma. And they won't even know they're sending them, but they'll change the workplace for those people because they'll know this is a place that sees them. This is a place that knows that they exist. So my shortened campaign version of this one for today, is that one. This is a permanent campaign. It is a campaign that has to be based on human stories and human reality. It has to be one that understands that you have to draw out active inclusion from people so that they can demonstrate their values. And, the great thing is these campaigns can and should be rewarding, but they are challenging because, and we shouldn't underestimate the scale of this. If we want to tackle this, campaigning is hard, and it's going to take a commitment to not switching off and to be continuously committed to it. So hopefully that's a good, useful starting point today. And I think I'm going to bounce back over to you, Nancy, or Rebecca, which...
Thank you, Tiernan. That was absolutely brilliant. And some of the questions have started to come in already, which is great. And just a reminder, I've just asked everyone to sort of introduce themselves in the chat. Just tell us where you're from organisation-wise and where in the world you are, just to give us a sense of the audience we've got. That would be excellent. But thank you, Tiernan. We'll hand straight over now to Nancy to take us through MediaCom's Mental Health Allies programme.
Hi, thanks, Rebecca, and thanks, Tiernan. I'm quite pleased because you've teed me up for quite a lot of my points, so we've got good synergy today. I'm just going to attempt to share my screen, which frankly is something that impacts my mental health quite negatively. So hopefully you can see that. I'm here today. I work for WPP. MediaCom is one of WPP's agencies, and I've been doing work around mental health in both of those places. And I'm just going to talk to you a little bit about what we've done. what I've tried to do today, hence the slides, is just be really tangible about the journey, because I know that this is a space where people are looking for some really sort of practical tips. And so Tiernan has absolutely sort of covered some of the sort of more conceptual and strategic points. And hopefully today what I'll be able to add is here's what it looks like when we put things in place. So our story began at MediaCom really in 2017. I'm going to be very open about the fact that it came really from one event. We had some speakers come in, the amazing Johnny Benjamin and Neil Leyburn, who, if you haven't heard of them, I would give them a Google, and they are brilliant people to get into speak in your organisation. They came in and did a session that was, I mean, very, very emotionally charged and really impactful. And really we did it because we thought, well, it would just be really interesting to sort of hear some mental health stories and understand this area a little bit better. But there was such a reaction to that event, and we had a lot of people coming to us afterwards and saying, that was amazing, what else are you going to be doing? Because obviously it won't just be that. And if I'm being really honest, at that time my plan was, let's just have this event and listen to some really interesting speakers. And so that was my sort of catch, really, that actually we've tapped into something where there is clearly a real latent desire for this to be something more permanent. And so that was the impetus really for us to put in place what we did. Because we felt like this was not a topic of conversation that we were having regularly at MediaCom. There definitely wasn't a history of us talking about mental health. It was not a thing that was discussed. Despite having a very familial and relaxed and warm culture, there was no sort of history of us discussing mental health. And so we started really with Mind's wellbeing index, because we just thought, actually, we need to understand this a bit better. And I think that's a very useful process. We got reams of data back that sort of told us where we are, how people felt, what was going on for people. And that was the thing that enabled us to then come up with a strategy. I'm just sharing a tiny bit of that data with you here. You can see that, you know, overwhelmingly, we were being told by our staff that this is massively impacting me when I'm in the office. These are not small things, right? You know, people not being able to concentrate, people procrastinating, people not being able to multitask. These are all things that are really impacting on our business, how people are operating, whether they feel like they're able to sort of fulfill the requirements of their job. These are really difficult and big topics. And we also learn that the vast majority of people who are experiencing poor mental health will cover that and come into work anyway. So that's 59% of people who felt like, yeah, I would definitely come in and I would push that down. I would try and make that not visible to anybody else. I would pretend that everything's okay. And that's compared to 27% of people who said they would do the same if they were physically unwell. Pretending, as everyone on the call will know, depending on how severe your sort of mental health experiences may have been, pretending never works. Covering is one of the most unhealthy things that we can have in the workplace. When people are not being authentic, when people aren't being open, they don't get the support they need. It's exhausting having to cover up this stuff and pretend that everything's okay. So it really was a very negative situation for everybody involved, and we really wanted to tackle it. We spoke to lots of different partners in the marketplace. We selected in the end an amazing company called Mental Health at Work. If you're not familiar with them, then there's a fantastic lady there called Alison Pay, who have a chat with her and find out a bit more about what they do. But for us, they were the right partners. They're part of the Mental Health Foundation, so we're very confident about their experience and their skill set. The difference for me, and the reason why we decided to partner with that organisation, is we wanted to put a program in place that meant that people could seek support when they needed it. We wanted to really normalise those conversations around mental health and ensure that people felt like, if I'm struggling, there is a person, I know where to go to get some assistance. And I think all mental health training is great. So whatever you're doing, amazing if you've done some. But for me, I think a lot of companies were using mental health first aiders at the time. And for me, there's an additional thing that Mental Health at Work, that they add into their remit and their approach, and that's the techniques behind having good conversations. And so for us, it wasn't just about understanding mental health better and understanding the terminology and knowing how things manifest. It's how do I have that conversation when I'm worried about somebody? If somebody's displaying behavior that I think is concerning, how do I reach out and ask if they're okay? What if their response to me is quite angry? What if they push back and they seem very upset that I've even asked? What do I do next? If someone is approaching me, how do I have a conversation where I don't end up projecting my own feelings or experience on that person? How do I ask open-ended questions to make sure we have a really positive conversation that's about them, rather than me bringing my experience or baggage to that? And so they're very, very technique focused. And I think, you know, we really wanted to be in that space where we were equipping people to have really good, positive conversations. And so we created a mental health allies program. So for us, it's not about first aid. It's not about patching people up and giving them some tools and sending them back out there. It's about someone that you can just lean on. So someone who's going to listen to you, someone who is going to listen without judgment, quite crucially, because we all often, without training, end up doing that. Somebody who is going to signpost and make sure that you can access help. Our allies are not trained counsellors. They are not mental health professionals, but they are there to say, okay, here's some stuff that I can get access to. Here's how we use EAP. Here are the different things that EAP can offer. It might be a local mindfulness class. It might be something that we have in our L&D remit. But the role of that ally is to say, okay, let's talk. Let me hear you. Let me give you a space to be heard. Let's have a good conversation about that. And then let me help you find places where you can access that professional help. In the most extreme of circumstances, and I have to say it happens much more than people realise, in the situation where somebody may be feeling suicidal, it's about what do we do in that situation? How do I help to keep that person safe? Now that's a really difficult element at the moment when we're working virtually. And this program is definitely designed before that virtual working. But that is something that when it happens, when someone comes and discloses that to you, it is frankly quite paralyzing. Like the fear involved in that conversation is quite extreme. And we wanted people to be equipped to have that conversation and to know what to do and to know how to safeguard and keep that person safe. That's the sort of classic ally role. So people are there for support. They wear green lanyards. We publicise who those people are. They're very visible in the agency, and so people know where to go to. The other part of the role is about ending the stigma. So as Tiernan says, this is a thing that's constant. This is a thing that we're chipping away at every day. This is not a campaign that's a one-off. This is not a program that we put in place and thought, okay, that's a tick, we're done now. This is the allies chipping away forevermore, really, on that topic. So how are they showing up in their own team meetings? How are they encouraging colleagues to be open? Are they talking about their own mental health? Are they being open and authentic when they have conversations about mental health? Are they putting nudges in place in team meetings so perhaps people can give, you know, we have some teams who will sort of go around team meetings and everyone gives a score out of 5 as to sort of how they're feeling that day. You know, what things are they putting in place where they're really helping to normalize that conversation? Because when we make this normal, when we make this a thing that's pretty standard and we aren't so terrified of talking about it anymore, that's when we can really help to reduce that stigma. I think some of our allies have been in a position where I think lots of them have been used extensively, others less so. And I'm sure there are some who've never been used at all. And I think that probably makes them feel a bit worried that there's something about them that means they're not doing the role properly. But for me, that isn't the important thing. It's the fact that they are there is symbolically important. But my experience as an ally, sometimes those conversations come up without any warning, and it's how you act in the moment. So people might not seek you out and say, I need to talk to you as an ally, but someone might seek you out in a more subtle way and have a really subtle conversation. And how do we deal with that organic situation as and when it arises? The programme, so it launched in 2017, it's been a huge thing at MediaCom. It has really helped change our culture. I think it has really brought people closer together. I know that staff are really proud of the programme. We have lots of people talking to friends and family about the program. We've helped other companies introduce something similar, because we get lots of people coming to us, and I think it's really had a positive halo effect on various different parts of our agency. And so we've taken those learnings and we have now rolled that out across all UK agencies that are part of WPP. So we have 250 allies in the UK just for WPP agencies now. We have a rollout in the US that's very imminent, so their training is about to start there, and so we'll soon be in a place where they exist there also. And actually that will be a much bigger program because we have a lot more people in the US. MediaCom have rolled this program out globally. So it's in multiple continents now, and there are definitely nuances in different countries, but there was a real sort of thirst in those agencies when we talked about the scheme. It was something that everyone felt, even if they were at slightly different stages of the mental health conversation. There really were so many people who were like, we definitely need this. This is something that has to happen. And so in terms of the WPP rollout, I'm going to centre on that a little bit more today, just to, again, be really practical and tangible about what we did and what things look like. We put out an appeal for people to volunteer. We produced a playbook where there's a screenshot of that at the moment, one of the pages there. We produced a playbook so that we could explain to everybody, this is what the programme is, this is the vision, this is what we're trying to achieve, and here's what it would take for you to be an ally. So we talked to people a little bit about what the time commitment might be. We talk about the qualities that might mean that somebody would make a great ally. And we asked each agency's leadership team to communicate that within their agency and to talk about the programme in general. We had hundreds of applications, and I was very relieved about that, because you never know if people are going to connect with something and think, yeah, that's something I want to dedicate time to. But we were inundated with people who volunteered, and we put those people through an application process and then selected our volunteers at the end of that. So quite a lengthy process. We wanted to put that application process in to make it clear to people that this is a commitment. This is something that's important to us as an organisation. And therefore we need to sort of go through the correct process to get there. And I think that was, yeah, a really beneficial thing to do. Once we found those allies and we trained everybody, we trained not only those allies, but we also trained HR professionals and also many of our senior leaders, because we want the language to be the same in different places. We want senior leadership to understand what we're trying to achieve and to be able to support the programme and talk about that programme with the same approach and language. Once all of that had taken place, we obviously then started communicating what the programme is within all of those different agencies. And so that's many different things, and again will be a thing that evolves constantly and is advertised constantly. So all of our agencies have posters and the sort of standard assets that you would think. We also made a short film, which I really would have loved to have played today, but my heart could not take the fear of showing a film on Zoom. So we made a short film that included many of our allies. They talk through what the programme is, why we have it in place, and then they talk through the process of finding an ally. So when you need support, how do you get to that person? And I think that video is really effective. I think people want to be able to see the types of people they might be able to talk to. It makes it feel more real, it makes it feel much more personal. And I think that there are definitely people in the film that people would have looked at and thought, okay, I feel like you're somebody I could talk to. There's something about you that means I could definitely connect with you. So we really wanted that to be very clear. And that's why we used lots of different media to make the point and to advertise what we were putting in place. We have really clear signposting all the time. So it's not just about the posters. If all of our allies will be wearing lanyards when we return to the office, so they're physically identifiable. We do lots of signposting in the sort of more boring places, for want of a better word. So as an organisation, we use Teams largely. all of our statuses on Teams will say, I'm a mental health ally. If you need to contact me, here's how you would do so. So even if I'm just in a normal meeting, if someone looks at the participant list, they will see who the allies are. We have it in our email signatures. We have signposting in our out of office messages. So if we're out of the office, it's like, I'm not here today, but here's how you would find another ally. Many of us have changed our email address to say MHA at the end for mental health ally. So again, there are these just sort of constant little nudges for people to hear about the program again and then think, okay, I see and feel that these people are amongst us and I know how to contact them. Obviously, being Chief Inclusion Officer, it's important to me that inclusion is really embedded in this, because almost always mental health is a very white and middle class conversation, and to take that slightly further, almost always a white female conversation, and we really, really wanted to challenge that. So in that application process for the allies, we made it very clear to people that we would like them to apply if they were from a marginalised community, or if they had something about their identity that they thought, you know, would make other people think that's a safe person for me to talk to. So that's from an ethnicity point of view, gender, you know, single parenting, country of origin, whatever it might be. We've made sure that we have a really inclusive group of allies. And on our internal intranet, that is where people can go and find them. And you'll see from this screen grab here, you can either go through the list, for want of a better word, it's basically a menu of mental health allies, and everybody has a little bio. So there might be something in there where you think, okay, that person's also from Italy, or that person's also a single parent. That's someone I'm going to reach out to. But you can also search by keyword. So if you are Black and you think I can only speak to somebody who is Black, who understands my experience at the moment, you can type in Black or ethnicity and you'll be able to find that person, rather than reading 250 bios. And each person you go on to, there are contact details there. They've done a little bit of a write-up about why they are an ally and what they might be able to bring to a conversation in terms of representation and understanding. I guess the tricky bit, in a way, that's the easy stuff. So it's really easy to train people and get a program up and running and say, right, here's what we're trying to achieve, but how do we maintain this over time? That's the part that requires the sort of heavy lifting, really, because once the excitement and all the enthusiasm and the passion dies down, it's like, this has to be a thing that just exists every day. So one of the key elements there is equipping the allies. So what we didn't want to do is to train people and then sort of, you know, 18 months down the line for people to think, actually, my knowledge is a bit rusty, haven't had many conversations about this recently, and my sort of skills are getting a bit out of date. So we've created that playbook that I mentioned, so that allies are always able to read that and to sort of regroup, understand what they're trying to achieve. We also have Mental Health at Work, our partners in this, also produced a playbook. So there's a bit of a summary, really, so that if anyone thinks, okay, I need a little quick reminder, they might be going into a conversation, for example, where somebody says, okay, I'm struggling with an eating disorder. So actually go back to the playbook, just remind yourself of a couple of details so that you can quickly gen up so that you're equipped for that conversation. And so that's a really rich resource, and our allies can go back to their training constantly on that. The most exciting thing that we're doing at the moment, though, and this is definitely sort of one of the evolutions of the programme, is to build a mental health academy. And so we are using a digital platform that will enable all allies and HR professionals to go onto the platform and to be able to find content on lots of different areas. So if they know they're having that conversation with somebody about an eating disorder, there'll be loads of resources about eating disorders. If they are worried that somebody is suicidal, there'll be loads of stuff on there about suicide and the language that we should watch out for, and the techniques of conversation. So they'll always be able to go back and think, I can revisit some of the things that maybe I may have forgotten. But crucially, there'll also be loads of really good content on there that we develop all the time. So Our partners at Mental Health at Work will be regularly filming short films about specific sort of deep dives into certain topics of conversation. That will be posted on there all the time. And so there'll be this constant drip feed of new information, recaps of what people have learned, to really sort of reassure people that they are equipped to have these conversations. There's also going to be a place where people can access supervision. So we have to look after the allies as well. We don't, you know, my experience as an ally has at points been quite difficult. I've had really difficult conversations with people who, particularly when people are expressing suicidal thoughts, that can be very heavy. Really, you know, that is something that you carry, that you take home, that you worry about that person for, you know, endless amounts of time. So we need the allies to feel supported. That academy will be somewhere where they can go, get support, flag that they need supervision from a professional, and a number of us are going to be trained on how to offer that supervision and how to have conversations to sort of support people when they've found things quite difficult themselves. So that's sort of our hub and our community. And really, from bringing all of these allies together within MediaCom and across WPP agencies, that is such a passionate group of people. I mean, I honestly, after we trained everybody, I honestly think they're the most engaged employees that we have. They are people who are like, I'm so proud that we've done it. I'm so proud that I have this knowledge. I feel very grateful to work somewhere where we're really investing in people and trying to make these conversations more normal and more everyday. And really another natural evolution of that program is that we have had ERGs develop from those allies. So there are allies who are like, I'm happy to be here and support somebody when they need help, but also I just want to be more active. I want to be doing things all the time. So what are the events that we can put on? Can we review policies that we have internally and make sure that they're okay from a mental health perspective? If we're hosting events, or if we are, you know, making structural changes to the company, they are now groups of people who can say, actually, I'd like to give some insights. I'd like to sense check what we're doing, and I'd like to bring some of my knowledge and some of my learnings to other areas of the business so that we can make sure that this is embedded and woven into really everything that we do. I could talk about this for hours, and I know I haven't got hours. So, but where we're headed next really is evolving that concept of allyship. And so, as I said earlier, I think some people are, you know, had their training or are almost sitting there waiting for the back phone to ring to help somebody. And that isn't how it's going to manifest all of the time. So we're really trying to evolve those broader principles of allyship. So how are you showing up? What conversations are you having? How open are you being about your own mental health? We have a really rich history of sharing mental health stories at MediaCom. Tiernan talked about that earlier. I couldn't agree more. When we started sending out people's own written accounts of their mental health experiences across a real array of different areas, you could have heard a pin drop in the agency. Rightly or wrongly, we are all nosy. We all like to read about other people. We all like that human connection. And so people's authenticity with those stories, I think, has really transformed how the mental health conversations in MediaCom have gone. And that's definitely something we'll be replicating across WPP. From a MediaCom perspective, obviously, because we are well into that global rollout now, we are doing a global survey across all of the countries where MediaCom is operating to understand what wellbeing is, what are the cultural nuances, where is the stigma highest, where are people really sort of struggling with having these conversations. And we're working with an organisation to get that feedback, so we really have that cultural picture across the globe. And although this isn't explicitly mental health, I think this programme and our experience with mental health allies has made us really understand that that allyship piece needs to extend to lots of different areas. So something that we're evolving at MediaCom at the moment is the concept of safe space allies. So they are people who are going to be having training, being trained at the moment actually, on microaggressions, equity, oppression, how do things manifest in the workplace. Often when these things happen for people in marginalised communities, there is an enormous impact on their mental well-being. To be experiencing microaggressions at work constantly and to have to hold that in and not react, it's awful, and has, as I say, has a massive impact on well-being. So we're taking some of those principles from the mental health allies and creating safe space allies, so that again there are people who are equipped to have conversations, sometimes uncomfortable conversations about things that have happened, to talk it through with people, to make sure they're not gaslighting themselves, to say you're right to feel that way, that emotion is absolutely valid, and here are the things that could be done about it. And so they'll be able to talk through what the HR process might look like if somebody wants to raise it formally. They might want to, role play a conversation with that person and just give that support and say, yeah, you should push back on that thing shouldn't have been said or shouldn't have happened. So it's really started to change other areas of the business, really. And I think empowering employees, educating them so that they can have difficult, challenging conversations is so important, and we can see the benefit now. It is, as Tiernan says, it's about chipping away at this all day, every day, and that can't come from just one person who's in the inclusion space. This has to be about everybody doing it constantly, and so that's where we're headed next. That's it from me, Rebecca. That was the whistle. That was the whistle stop to all of that.
That was fantastic. Thank you, Nancy. I've actually got some quick fire questions on the Mental Health Allies programme before we sort of take it back out to more broad discussions. We had some interesting questions come in. One of them was around how many mental health allies have you got versus your sort of employee numbers, just to give a guidance to the audience if they're thinking about something similar.
Yeah, so when you look at WPP in total, we've got about 9,000 people in the UK, and we've got about 250 allies. It exists at that umbrella level, but it also exists within the individual agencies as well. So I would say in MediaCom, we have about 1,700 employees in the UK. I think we've got about 50 allies. But we have really small agencies where there are 20 people and there will be 2 allies. So we never drop below a certain level. We always want there to be 2 or 3 people in the organisation, even if it's very small. So the ratio is slightly different. But collectively, yeah, we have 250 for about 9,000 people.
Brilliant, thank you. And the training for those allies, just, I think someone's asked a question, but I think you did mention, is that with your partner Mind, so Mental Health at Work?
No, so it's not Mind. Mental Health at Work are a different organisation. So Mind, we did the index with them, their wellbeing index, to get the data, and then we partnered with Mental Health at Work to do the education piece, and that training is honestly exceptional. We have never had such positive feedback about any training of any form. And I think it's that piece that, I mean, not only are they just very good at that training, and it's a mix of theoretical stuff and practical stuff, it just impacts people's professional and personal life. I mean, it's so enriching. So I think a lot of people went on that training and thought, that's amazing, I've got skills that I can use at work, but also actually I've got a partner who's really struggling, and this is going to be really helpful in my normal life as well.
Fantastic. Well, thank you so much. And I'm going to bring us back out to some of the sort of broad themes of the questions that have come in for both of you. And I think a couple of them have been, as you're sort of starting out thinking about how you launch these campaigns and put these initiatives in place, there's a conversation that needs to happen with your leadership, and that buy-in really needs to be there, especially if you're thinking about momentum and continuing those efforts. And that obviously leads to a question around capacity and resource, and there's been quite a lot of questions come through about how you sort of build that in. So I wonder if I could put those 2 questions to you. So the first being, how do you get leadership on site? What's your advice for our audience in terms of convincing them that this is the right thing to do? And then secondly, thinking about capacity and as you've both said, this is about a joint effort across the team, but these employees have their day-to-day jobs. So how do you make sure that they have the time and the space to do this work alongside their day jobs, and it doesn't lead to things like burnout, which obviously we'd want to avoid. So Tiernan, perhaps I can kick that over to you first.
Sorry, to who?
To Tiernan, sorry, did I go off
there? I think it's a couple of things on the leadership one. I suppose there's 2 journeys for everybody, including leadership. One is, are you in favor of this? And then how do I become an advocate for this? So the short answer, I mean, you would hope that most leaders are in a position where they understand that well-being is good for their workforce and their firm. But it may be that if you're a very early stage, there's actually a persuasion piece to do with leaders about the benefit of mental health and well-being, which is why I actually check out resources, honestly, like the GBC here, about trying to find out, here's the case. Now, I would hope for most cases in most leadership, you're not at that stage where you're trying to go, here's the case, but let's not presume it's true for everyone. So do get the resources, make the clear, case about the economic impact of this as well, to get them over the line, as well as the cultural impact in general. I think the second more important point, hopefully, is where most people would be in this question, which is, how do you get them to become active advocates? I think you really have to sit down with your leadership and get them to understand none of this will work without them. It just won't happen. And you could produce, and I've seen another question in here today going about, as well as the campaign, what are the initiatives? You can create all the great initiatives and all the great resources in the world. No one's going to access them if they think their leaders aren't on board. They're just going to go, yeah, this is all PR and HR. It's not actually core to who we are. I mean, and this is the purpose of, in a way, the topic of today is stigma is like a pervasive and really tough barrier. And without leadership being visible and including not just promoting the value, but what we found in the firm as well, talking about their own stories, which can be utterly transformational, because again, we know this. Look, we can beat around the bush all day long about this, but we know that there are people who don't want to talk about this because they perceive that the stigma is real and is connected to weakness. It will damage their job opportunities. It will damage the way people will think about them. And there is simply no way to address that simply by resources and initiatives. They have to hear this time and time again from the leadership. And the leadership have to know, not alone do they have to hear it once, but it has to be a topic that the leadership continuously return to, because you're trying to create confidence that dismantles the stigma inside our building that we haven't dismantled outside our building. And that's the level of leadership we need from the top management. So you got to sit down with your team, you got to sit down with your leaders, take them on that journey and really help them step up as advocates. They'll find it rewarding though. The feedback they will get is awesome, because they'll unlock a door, for so many people, and people will tell them, thank you so much. But sometimes you just got to get them there. Won't work without them.
Thank you, Tiernan. Nancy, have you got anything to add to that on the sort of buy-in leadership side, and then perhaps sort of particularly reflecting on mental health allies, that capacity and resource question might be quite helpful?
Yeah, echoing what Tiernan says, really, I think the sharing of stories from people in senior leadership can be really transformational. I think that quickly needs to be followed by stories from all levels, actually, because leaders need to spark that and send the message that this is safe. But I think that when you don't have different levels of the organisation sharing stories, it makes people feel like, oh, okay, you can share it if you're senior because you're safe at that point. So there does need to be a bit of breadth there. We were really lucky, haven't ever had any trouble selling in anything to do with mental health. So maybe I'm not the best person to answer the question, because people have always been incredibly supportive. I would say that if people are struggling to sell it in, though, I would do something like the Mind Index. Because if you've got the data, if you can start putting numbers to it and saying, right, this is how many people are maybe out of the business and we don't even know it because they can't even be honest about why they're not here, I think that can be really helpful. In terms of the allies and capacity and things like that, I think it's very, very rare that any of them have been really sort of massively burdened by this. This is not something where people are picking up conversations every single day. They are having organic conversations with people in their team that are just normal part of management, and those conversations are just better than they would have been without the training. But they're not having people coming to them every single day asking to speak to an ally. So we haven't had a problem. We haven't had a point where there is a problem around capacity. I do think they're a really engaged group of people. So honestly, most people would say, oh, I want to find the time for that. That is much more important than my account queries or whatever they're working on. We do say to allies, though, that if you have to have a break, have the break. So that signposting I talked about out of offices and things like that, if people are struggling with their own mental health, if they are really, really busy, we switch them off for a temporary period of time. So we will take them off of that list of allies. We will ask them to put the signposting on so that you're redirecting people somewhere else. So we definitely advocate that. You can have a little break. It could be, 2-week, 9-month break. It doesn't matter what it is. Like we'll switch people on and off as they need it, because it cannot lead to burnout for the allies.
Perfect. Yeah, absolutely. Thank you. A couple of other themes that have come back from our audience today is about this idea of ongoing campaigning and keeping up that momentum. And interestingly as well about this idea of trying to break out of the same people putting their hands up to do that work all the time. I wonder whether you had some sort of top tips in terms of trying to keep up momentum, what you found has helped quite well, but also how you try to break out of that sort of usual suspects participating and into those other parts of your organisation that are perhaps a little bit more reluctant to put their hands up for the activities.
I think it's one of the challenges of continual campaigning, obviously, is as a sentence, it already implies this could be exhausting. And in a way, it's one of the challenges of stigma, in that we have a goal, but there's no finish line. It's going to be very challenging to unbake it. But you can continue to make advances. So I think, first of all, for continuous campaigning, it's always remember to mark victories and celebrate moments. People have to feel that there is momentum and that it's going somewhere. A permanent campaign that just feels like it's on a treadmill is one that people will drop out of, because they'll just get exhausted and depressed. And ironically, which is not the outcome you want for a mental health and wellbeing campaign. And so, marking your victories or finding moments to celebrate advancements so people can see that the journey is working becomes really important in a permanent campaign. And the other bit does reflect this. In a way, the question answers itself. You need to be thinking, keep continuously looking for people to bring in, that this doesn't fall on the usual suspect shoulders, that it doesn't become, I think, two problems. One, something that is about other people, in which case it falls just on a few people's shoulders, that it's about everybody. So that you're already opening up access for talent to come in and do more campaigning with you, that you're framing it, this is about for everyone, not just someone else over there. But also that you're actively trying to find people. The worst thing is, and we see this all the time for campaigns, a lot of which are voluntary. A lot of this work will be voluntary within your firm, that it falls on one or two people, and then they get burnout and they're gone. And then you're left with no second, people to pick it up afterwards. So you got to keep your eye on this one and constantly recruit, constantly pull people in. But building a permanent campaign that is enjoyable to be on, because if it's not stopping, people will leave it if it's not enjoyable. So, keep it, and they might seem like simple framework concepts, but I think they're critical. Keep people wanting to be there, keep celebrating your victories on a permanent journey, and keep recruiting.
Lovely. Thank you, Tiernan. How about you, Nancy?
Yeah, it is really tough. I think definitely celebrate those wins when they happen. So we did the Mind Index, and then we did it a couple of years later. We saw massive shifts in some of those scores. There was some scores that had gone up by 20 or 30% in terms of people saying, I believe that the company will do something if I'm struggling. So we had some really sudden and positive improvements. And I think it's important to talk to the whole organisation about that and say, look, this is what happens when you get involved. This is where we move to. And just very quickly, I would talk about the intersectionality point. So around it's the same people doing it all the time. And in my experience, when it is mental health, it is very often white women who are doing it. So think about the intersectionality. So we have Black History Month coming up. We will be doing a session around Black mental health. So actually, what other ERGs can you pull in? What other communities who maybe aren't in your mental health space? Who else can talk about mental health from their perspective? That's how you sort of weave it into the everyday. It's not about, it's World Mental Health Day, let's just do something now. It's what's happening in the whole organisation all the time, and how do we seed in mental health and the wellbeing messages in everything else. And so you can start to make it other people's responsibility, because it's about business as usual being involved, not just the high profile things.
Brilliant, thank you. Well, we're over time, and appreciate you staying on for a couple more minutes. I'm just gonna, I know we've had lots of questions, particularly very specific questions about the Mental Health Allies programme. So if you want those answering, please do drop me an email, which I put in the chat, and we can try and get those answered for you at a later date. But what I just wanted to finish off on, because a lot of our audience that engage with us are smaller or sort of medium-sized businesses that perhaps are starting out on this journey. And it can seem quite daunting to sort of look at this in such a large way from a sort of campaign perspective, or sort of launching a big program. But obviously you've been there once, you've been there sort of setting out on that journey. So what, just to leave the audience with, what would be your sort of recommended first couple of steps that you would advise that they take to sort of begin this journey?
I do think it's really important that you find a good partner to do it on. So this is too important a topic to be doing with your own research from the internet. And so, you know, it really, I think you can do things on small budgets. I think you can do things if you're in a really small organization. We have tiny agencies in WPP who have this program up and running. So I know that it's possible, but I would say it is important to, even just at the start, to find a small sum of money to invest in that training and that education, because there are certain things that we can do on a shoestring budget. I work in inclusion. I'm well used to begging and borrowing and stealing, but mental health wouldn't be the place to say, let's create our own education on this. So I think find a good partner, somebody like Mental Health at Work, and there are lots of partners out there. Make that small investment at the beginning so you do have the right skills, the right level of education and the expertise. And then really all we're talking about here is about encouraging human conversations. So you don't need all the assets that I've just shown. I mean, great if you can have lanyards and great if you can put people on your intranet, but you don't need loads of shiny, sparkly assets. This is about having conversations, encouraging conversations, leaders talking about things in a town hall or a meeting. I think after that education, this can be done with very few resources, really. But the education piece, you just can't, you can't bypass that cost, unfortunately. It's too important.
Thanks, Nancy. Yeah. How about you, Tiernan?
I mean, very briefly, for people's time, sorry, I think a couple of things. One, honestly, get yourself a roadmap. So, and that's one of the things the Global Business Collaboration does. It sets out the pledges so that you can take a look at your own roadmap and go, where do I want to go? Because there's obviously, there's 100 actions you could take. There's 100 actions all of us could take, but drawing out a map and going, okay, well, it all starts with step one. And that's the importance of taking a look at the pledges and taking a look at, you know, the kind of roadmap you can build around that. Really important. I think Nancy's totally right. Try and find a good partner. There's so many good resources out there. You oftentimes you don't have to reinvent the wheel. There can be some brilliant resources that are off the shelf. They're not tailored specifically for you, but again, it depends. In terms of resourcing. So some of them can, be really perfect and, really land well. So, getting the good partner is really important. And the other one is once you have, get your roadmap and sit down with your bosses. You got to get them on board, and got to get them on board, not just in favor of it, but you have to turn them into advocates, because I think that's where you'll really start to see, if you were looking for one thing to do, get them to stand up.
Absolutely. Well, thank you both. It's been absolutely fantastic to have you both on today, and all your insights in health. And to that point on resources, we are as a group looking to sort of build a list for you that are free. So do watch this space on our website as well in the coming months, where we hope to get those up for you. We'll also be in touch about our next Pledge With Us episode, which will be all about how you build that culture. We'll be in touch very soon about dates, so please do make sure you're signed up to our newsletter or follow us on social media for those latest updates. But thank you for joining, attendees. Thank you to Tiernan and Nancy very much for your time today. And yes, we'll be in touch with a recording and Nancy's slides as well, should you want to share that more widely within your organisations. But that's it from us. So thank you very much, and have a good rest of the day.
Thank you.
Bye.